Like they've had this question several times.
Let me hear it.
Okay, because you've really got to respond to it. So the whole idea of better healthcare, universal healthcare, how can you trust the government to deliver Medicare for all?
God damn this. Are you kidding me?
No.
This is that question?
This is his question. And
okay, here's the question. Here's the answer. How do you trust the government to get the water to your house every day? How do you trust the government to get the sewage out of your toilet every day? How do you trust the government? I don't know. If you ask people, if they do surveys, the most popular health insurance program in the country is Medicare. So I want one that's better. So I'm not saying it's going to be perfect, but it certainly is going to be better than a for-profit system that has us paying double what the rest of the world pays for worse outcomes. Why is it the rest of the world's governments can somehow deliver health care in a way that's half as expensive and gives you better results? I want that. And again, the government isn't giving you health care. They're paying for it. The government's not going to run the hospital I go to. The government's not going to run my doctor. What the government is going to do is cut a check to the doctor that I go see. That's what the government's going to do. The government isn't going to hire a doctor and send me to a government doctor. I'm going to my regular doctor, except that now it doesn't cost twice as much because we're cutting out the middleman and we're regulating drug prices. That's the difference. Okay. Hey, how could you drive on a road? It's been built by the government. How could you go into a post office? It's built by the government. How could you go into a library? It's built by the government. How could you go into a college? It's built by the government. Again, that doesn't mean it's perfect. It means it's better than a for-profit idea of how to deliver education or health care. Does that answer the question, you think?
Did you ever go into debt because of medical bills?
Yes. Guess what else you don't do when you have Medicare for all? You don't have to worry about getting sick and going broke. Because you know how many medical bankruptcies they had in Canada last year? 0. You know how many the year before? 0. You know how many people died because they couldn't get health care? Probably 0. So there you go. In America, people are on the streets. They're bankrupt. I got bankrupted because of health care, and I had insurance. Most people who go bankrupt from a medical bill have insurance. So that's the jokey there. So that's why. So that question, people always say that. They say, if you don't trust the government, why do you want them to run your health care? They're not going to run my health care. They don't run. They pay the doctors. My father, when he goes to a doctor, he doesn't go to a government. He's not seeing a G-man. He's going to his regular doctor. The same doctor he went to see when he was working, and now he's retired. Same doctor, he doesn't have to pay for it. That's the difference. And there isn't a middleman charging 30% markup. Okay, so
all right, that's great.
But if you want to trust big pharma, you think big pharma and big health insurance companies are giving you a better deal than you would get from a public option? Do you know what the public option even is? Do you think you're getting a better deal from Aetna and Blue Cross and big pharma than you would be getting from a public option or Medicare for all? Do you really think that? Well, you're uninformed in the extreme.
That's terrible. He just wants to promise Medicare for all. So listen, he's right. Premiums have gone up about 22% in 1 year from 2016 to 2017. Now, when I first read that too, I thought it was low. 22% over 8 states, it went up 30%. But that's 1 year. That's 2016 to 2017. You add that up year over year since the Affordable Care Act has been passed, you have people paying hundreds of percentage points more than they were before. Deductibles on average are $6,000 per individual right now, $12,000 per family, which was completely unheard of before the ironically named Affordable Care Act. And the solution from Bernie Sanders, and I know people like him because they think he's sweet and he's genuine versus Hillary Clinton, blah, blah, blah. Okay, there. But his solution is Medicare. Medicare for all, which is an entirely broken system. I'll continue to get into that, but a liberal think tank estimated that Bernie Sanders' proposed plan would add $32 trillion in federal spending over the next 10 years. This isn't the Heritage Foundation. This isn't coming from Fox News. This is coming from a leftist think tank. This is the best case scenario. Medicare at this point, by the way, is basically already insolvent. If you look at the CBO reports, they plan for it to be completely insolvent, well, now. And so people are trumpeting, Obamacare saved Medicare is what they say. Well, really, there's a clever accounting trick because Medicare is still on the brink of insolvency, as seen in the real world practice of Medicare since the Affordable Care Act is that fewer doctors than ever in the history of the United States are willing to take Medicare. 1 in 5 doctors flat out will refuse any new patients who use Medicare at all. And this idea, Medicare for all, is based on we need to get with the industrialized world with single payer healthcare, right? Well, I come from a single payer healthcare system. Take a guess why we left. Now I get that's anecdotal. So let's get to the statistics. First off, keep in mind that none of these other countries have to fund national defense effectively for the entire industrialized free world.
That's us.
And their taxes are the kind of taxes that you would complain about if you ever had to pay 52% income tax, like people have to pay the marginal tax rates in Quebec, you'd have riots in the streets. So let's keep that in mind. But let's just get to some quantifiable statistics. Wait times. Well, my home province of Quebec, if you look at the wait times for people who claim or people who have waited over 5 hours in an emergency room, keep that up there. That's 35% of people who go to an emergency room in Quebec. That's better than the national average in Canada at 19%. Now, you look at those numbers, United States is effectively the best on that list. And let me tell you why. That's because the United States has a 5% amount of people who've waited for 5 hours or more. Now, Germany has that, as does the UK, the Netherlands. But if you add up all of the other countries that have 5% of that kind of a wait time, cumulatively, the average of those countries is 1/10 the population of the United States. And the Netherlands, by the way, 1/3 of their entire citizenry are privately insured anyway.
Jeez.
So keep that in mind. It's not even close, let alone Canada having 1/10 of the population. 1/10 the population, and their basically wait times are better in the United States than anywhere else. Quality of care. Well, listen, they use the best technology. They have the best technology. Most medical research is coming out of the United States. Not only most medical research coming out of the United States, but they're the ones who are actually able to use it and actually make it more affordable to the most amount of people in their countries. Just for an example, where I come from in Canada, in the United States, we have 9 times per capita. 9 times. I don't remember him being absent 9 times. 9 times the MRI machines. Grace! 9 times the MRI machines per person of Canada. Your rate of dying from breast cancer, prostate cancer, pick your cancer, can be up to 2 times the amount in New Zealand or the UK, Germany, depending on which kind of a cancer it is. Basically, your best chance of surviving a terminal illness is being in the United States. And that's across the board. That's across the entire economic spectrum. And Bernie Sanders likes to act as though there's classism here in the United States and there's equality. There's equality amongst the crappy care in these other countries, right? First off, you're taking Norwegian countries, you're taking countries with 1/10 of the population, an entirely homogenous population, and the care sucks. But the argument is at least everyone gets sucky care. But that's not even the case. As you see with Canada, as they start to open it to privatized system, what ends up happening when you have privatized healthcare along with a socialized healthcare? Only the super wealthy get to go to, in Canada, what they now call super hospitals, or as we know them in the United States, hospitals, where they can get the decent care and everyone else gets put in a line 12 months for an MRI. So let's go with that, Bernie Sanders. It's the compassionate thing to do.
For that, the first thing to mention is that all of the countries that are doing really well on healthcare also were doing well on healthcare before the implementation of a nationalized healthcare system. It's not the national healthcare system that changed Sweden into a healthy country or Norway into a healthy country. These were healthy countries before that happened. That's just the way it is. The United States is mainly unhealthy because we eat a bunch of shit here, right? I mean, that really is the reason. Our diet is really different than it is in, for example, Japan or in Norway, where people tend to exercise more and are healthier as an overall metric. So comparing populations is not like, it depends on where you are comparing. If you compare Norwegians in the United States to people who live in Norway, my guess is you probably wouldn't see an enormous difference in the level of health care obtained. Number 2, the United States healthcare system is a disaster area. It's actually the worst of all possible worlds. It is not a free market system, and it's not a totally regulated system. It's somewhere in between, which means it's heavily regulated and heavily subsidized, which leads to increased costs. That's why it's so expensive. When we say that we're spending an enormous amount per capita, we should define who the we is. The we is not the government. The we is the government plus private expenditures on healthcare. Now, it's my decision whether I want to spend a lot of money on end-of-life care. It's my decision whether I want to spend a lot of money on immediate care. So it's not quite a one-to-one ratio the way that people are making it out to be. And that's why in the United States, for example, when it comes to 5-year cancer survival rates, we actually rank #1 in the world. That's because you actually have availability of healthcare if you can pay for it. The question is, how do you bring the cost down? So now to my model of how I think about healthcare. Dan McLaughlin in National Review puts it this way. He says you can have 3 things in healthcare. You can have affordability, universality, and quality. Those are the 3 things that you're looking for in healthcare. Every system can guarantee no better than 2. So most of the systems that you're talking about, if they are universal, they are not affordable in the sense that the government does rack up enormous surcharges on that basis. Now, that may not be as much as we're spending here because, as I say, we have the worst of all available systems. We're not free market and we're not nationalized. But Canada's healthcare system is extraordinarily expensive. Britain's healthcare is extraordinarily expensive. Norway's healthcare is extraordinarily expensive, which is why the tax rates on people in the middle class and lower classes is still exorbitantly high. Like the United States actually has a far more progressive system of taxation than Switzerland or Sweden or Norway. Right? All of those countries have income taxes of 60% for folks making about 60 grand a year. It's really, really high. There is a cost to it. Now, the question is, what are you looking for? So what I am looking for is affordability and quality and not universality. Universal health care is good if you're looking for universality. If you're looking for universality and affordability, you don't spend a lot of money in your ration health care. You see some single-payer systems that are like this. If you're looking for universality and quality, then you don't care that much about affordability. You just spend an awful lot of money on it. And if you're looking for quality and affordability, then you have a free market system because that's what free markets generate. They can generate near universality, but not complete universality. This is true for food products, for example. It's not true that everyone has equal access to food, but food is extraordinarily cheap in the United States and very high quality, at least what you can get. So the question is, how do you wish to define the balance between rights and duties in a civilized society? My answer is I want affordability and quality, and I want social fabric picking up the rest, particularly at local level and hopefully before you get to the governmental level. The problem I have with the universal healthcare system is that it tends to drive down supply of doctors and nurses unless you spend exorbitant amounts of cash, right? You have to import people from other countries to do that work. This is what's happened in Britain, where they're importing a lot of their healthcare system from India, for example. Or you have to spend enormous sums of money. So are there nationalized healthcare systems that are better than ours? Yeah, there are. Australia is better than ours. Switzerland is better than ours. And I agree with you. If you were going to do this, you would want a 2-tiered system, right? Which is more like Switzerland. But in my view, the best of all available systems would be a wild deregulation of the healthcare system itself, leading to lowered costs, higher quality, and then what's left over can be filled in with relatively minimal investment. Love you too.